The EVEREST-2 study randomized patients with mitral regurgitation to either surgical or MitraClip therapy. The results were actually striking. Safety was clearly superior in the MitraClip group, and so far reports indicate that there is equivalence as far as effectiveness is concerned. But because we know that surgery has good long-term outcomes, especially in patients with mitral valve prolapse, the reaction to this trial has been lukewarm. But the trial had data within it that may be far more reaching for those of us keenly interested in the question of how best to treat MR in patients who are not good surgical candidates. In other words, those with high surgical risk. Now in JACC, there is a report of the EVEREST-2 high-risk study in patients with estimated surgical mortality risk of more than 12%. Now, this is really a registry and not a randomized part of the trial, but there was a comparator group that were screened and not enrolled and identified retrospectively. 78 patients were reported. Their mean age was 77, 50% had previous cardiac surgery, and about half had either functional or degenerative MR, and their STS score was about 14.5%. 96% had successful placement of the MitraClip, and at 30 days there was no difference between the MitraClip and comparator group, but at 1 year, 76% of the MitraClip group were alive compared to only 55% in the comparator group not treated with the MitraClip. And here are further fascinating data. With reduction in MR in the MitraClip group, left ventricular dimensions improved, as did New York Heart Association class and quality of life measures, but perhaps most importantly, hospitalizations for heart failure decreased significantly as well. I think this may be the first glimpse of what MitraClip therapy can really accomplish. It's the high-risk surgical patients that are probably the best candidates, and let the surgeons take care of younger people with prolapse. They do that operation well, but keep your eye on the ongoing registry for high-risk patients being treated with the MitraClip. I believe that will be a happy ending to the MitraClip story. I'm Peter Block, and this is a CardioSource Heart Minute.